Thank you very much and good morning. Firstly, apologies for a croaky voice. I've got this cough thing that half the people I know seem to have at the moment, so if I break off and cough, I'll try and do it quietly. Thank you. I'm going to talk to you about quality care. Now, we've heard a lot of things about the fact that Scotland has a world-class NHS, and we do. We know that mostly the care that's given is really excellent. What I want to have a think about this morning is about how do we know it's good? In other words, what are the components, the characteristics of care, and how do we then monitor it to know that we're actually giving good care, that you're giving good quality care, that we can show that that is what is making the difference. Because it's a changing field, as we know, that the maternity services are changing. As they change, we have to assess, we have to monitor, evaluate how things are changing to make sure that we know that the changes that are being introduced are actually making the difference. So, you may recall, those of you who were here last year or who watched it online last year, this framework, Quality Maternal and Newborn Care Framework, which was published in the Lancet series on midwifery, which came out 4 years ago. Alison McFadden, my colleague from the Mother and Infant Research Unit in Dundee, talked about what's in this framework. Now, I'm going to talk a little bit about it, but particularly why it's important for you as midwives to know what's in it and how we've used it to try and assess care. I'll just let Mary Renfrew very quickly introduce what it is. She was the lead author on the first paper which introduced the framework.
The Lancet series on midwifery is a series of 4 papers looking using a different range of research methods at the strong evidence now that we know that underpins the importance of midwifery for mothers, for babies, for families, for communities in low and middle and high income countries across the world. We've looked at the impact it will have, we've looked at how it can save lives and help improve health and well-being, and we've looked at how to implement that in a health system. And so it can be used now by decision makers, whether those are policy makers, ministers of finance and health, or whether those are health professionals themselves, or indeed women themselves, in helping to develop health systems that will be effective and efficient and good for women and babies.
Okay, so that's just a brief introduction. What I want to show you is about where it came from and how we're actually using it. It took all the global evidence, and it is a global tool, and said this is what quality care looks like. This is what the evidence tells us makes a good difference, makes better outcomes. And that's what we're all in the game of trying to ensure, is better outcomes for women and for babies. So it's what works. Crucially, it incorporates what women say. It's not just a top-down approach saying we've got evidence that shows that women are involved in this, about saying what they think is important about the care, the quality care that they actually give. And crucially, it really focuses on the contribution that midwifery makes to that quality care, because midwifery actually is at the core of this. So it describes the role of midwives and others in providing midwifery care. So that's what the framework looks like. The role of midwifery is almost all of it. It's everything except that top right-hand box, which is medical obstetric neonatal services. Now, traditionally, around the world, that's where the bulk of the finance goes. It goes to fighting emergencies, to dealing with obstetric emergencies, and that's where most of the research, most of the care money goes in that top right-hand corner. But actually, it's everything else. If we focus on that, you improve outcomes across the board. And that's what the Lancet series framework actually shows. So the role of midwifery is to give all of these things. I'm going to talk about just some of them. Obviously, it's a very busy framework in the sense there's lots in it, but I'll talk a little bit about some of the bits and how we're using them to try and assess quality care. All women should get this. That's the other thing, is that even women who get the complications should still get all of those things in all of the other boxes that I'll talk about in a minute. So it's something that wherever you're working as a midwife, that's the care you should be giving. So I want to encourage you is that think about it. And we talked about revalidation, thinking about what kind of care do I give? How do I know I'm giving quality care? How do I evaluate that? How do I know it's making a difference? These are all interesting things, but very useful things for you to think about your clinical practice. Some women and babies also need that, but as I say, all women, including the ones who have complications, need everything that comes in the rest of that framework. So we looked at the framework, and we thought it is a global tool. It's the evidence from around the world that says what works. So if care is organised along these lines, so the practice categories, you're giving education, there's good health promotion, screening, promotion of normal processes and all the rest of it. The organisation of care is available, it's accessible to women, acceptable. There's continuity, crucially, in there. All that's in there is that's organised by policymakers and by managers along those lines. And if the care you give is everything else, you're respectful, you communicate well, you tailor your care, you're optimizing social, cultural processes, as well as physical and psychological processes, there's expectant management, everything else that's in there. If you're doing all of that, then there isn't a problem. But of course, we live in the real world, and life ain't always that simple. Not everything goes well every day. We've done some preparatory work, which I'm going to talk about, assessing the quality of care that's been given, and mostly it's very, very good. That women really get on well with their midwives, they like the care, they like the service, and most of them come out with good outcomes. But that's not across the board, and we know that. Everybody knows that. We have had some stories of women telling us that they actually didn't get on terribly well with their midwife. So we have to be prepared for the bad news as well as it's mostly very, very good news. So the point we're trying to say is that if all women should get the care that's in that framework, doesn't it make sense to evaluate care using that framework? It's a really good, useful tool. So what we did is we took the framework and we transformed it into a focus group topic guide. And some of you may even have been in some of our focus groups. I know the slide's a bit busier, so I'm just going to show you one little excerpt from that because it's too big for one slide. We looked at, for example, we looked at the values thing, and this is what values in the framework says. Values are respect, communication, community knowledge, and so on. So we translated that into a question saying, do you feel that women are shown respect within this model of care? And then a supplementary question, was care tailored to the needs of individuals? So in focus groups, you're allowed to follow the conversation. So if it goes off at interesting tangents, you're allowed to follow them as long as you bring them back towards the end. So we're developing the framework to say, that's what quality care looks like. We're using that then to ask midwives, obstetricians, pregnant women and new mothers, whether they agree with that, what they think, what their perspectives are, what their experiences are. We've included dads actually in our latest iteration of this. We're just finishing the analysis on that. So, and there's other people we could involve as well, but this is just piloting, we're trialing it. So we ran 12 focus groups, a total of 69 people. We had, as I say, pregnant women, new mums, midwives and obstetricians, and we did a fairly standard thematic analysis of the themes, and we found 4 main themes. It's related to organisational culture, work structure, very much about relationships. It's related to information and support. But what we found, it was a kind of surprise to us that this theme of uncertainty came up, and this came out of the negative aspects of those first 3 themes. It created this other theme, which we didn't really expect to see, but it came up, and it was about, I don't know, what happens if things go wrong, then what happens, I don't know. And subsequently there's a loop-back mechanism because they try and find out how to resolve that uncertainty, but there is definitely this uncertainty, this not knowing how things happen. Will it work for me? Will I be safe? Lots of questions like that. So we mapped that back to the framework, and it's quite easy. Organisation of care is one of the components down the side, and obviously organisation culture maps very strongly to that. It's a very neat picture at that macro level. But then if we look at the sub-themes that go up to make organisation culture work structure and try and map that across to the 5 components of care in the framework, it's a really complex picture. It's actually quite a messy picture. If we look at adequate resources, obviously that relates to the organisation of care, but it also, positive ways of working rather, relates to organisation of care, but that also relates to the values of the caregivers. It relates to their philosophy, and they're slightly different, they overlap a bit. But obviously it's about the caregivers. The strategies for improvement are about practice categories and about organisation of care. And you can see that the sub-themes, as we go and we map them across, they really map across all of the components of care, the 5 components of care, and the characteristics which are in these boxes. And the negative things, limited resources, that's about organisation of care. System-driven care is about organisation, but it's also about the values of people within the health service. It's also about the philosophy that they hold and about individual care providers. Fear of blame was a big one. That's about values and it's about care providers. Boundary tensions, that was quite a big one. That's about midwives and obstetricians not agreeing on when referral is appropriate. And that was actually quite a big issue. And it's an interesting one because we've done some other analysis where in Australia they're doing something which I'll talk about in a minute as well. The midwives want to keep control of the women and the doctors want to keep control of the women. Now there are financial reasons for that. It's a slightly different health system, But it's interesting that they both want to keep it. What we found here was the opposite, was that actually they were both wanting to refer the women away. That the midwives were saying, this is too complex for me, it must be your job. And the obstetricians were saying, that's not an obstetric problem, it's not my job. So the women were getting caught between this thing about sort of, nobody seemed to want to look after them. It was somebody else's job. So that was a negative thing that came around. So these boundary tensions were really quite negative. So it's about philosophy, it's about the care providers. So what we have here is really quite a complex picture. It looks quite a messy picture. And in fact, what we really thought about is, what it is that these 5 components of care, they blur into one another quite a lot. And that's because life is not simple, care is not simple. That you can have a diagram, this framework, which puts things into nice, neat little boxes, but in real life, these boxes kind of merge and they overlap and they sometimes cover each other slightly. So, but that's okay, because what it means is that we know what's in the boxes, we know that they relate to one another. So by way of example, we look at the third theme was information and support. And effective communication was one of the big things that came up in terms of information and support. Now, effective communication, that relates to values, because communication is one of the values there, about that you have respect, there's tailored care. You can't have that without good communication. But equally, you can't have good organisation of care about the fact that it's integrated continuity. That doesn't happen unless you've got good effective communication. Also, the philosophy, optimizing social processes, psychological processes, that doesn't happen unless there's effective communication. And again, care providers, interpersonal competence, you can't have that without communication. So communication runs across everything, as we know, we all know that, it does that anyway. So it maps across the way. Now what the framework helps us to do is to see where these interlinks happen. And that helps us to know, if we identify problems, what likely effects that's going to have in terms of delivery of care. So, the framework can indicate what quality care looks like, but it doesn't tell you about that complex interplay of different factors within care, because it's a nice, neat diagram, and life is not neat. So these interweaving strands, it's really important to understand what's going on there, but that does help us to understand in terms of clinical practice what is going well and what's not going so well. And that's crucially because we were also looking at different models of care, and that tells you about what's working well in one model of care, but not so well in another model of care. And that's really, really useful, particularly when, as at the moment, we're developing new models of care, there's a shift towards community-based continuity of carer. We'll have to see in what way does that work better than, if you like, for want of a better word, standard care, the old-fashioned, traditional community, hospital-based care. In what way is it different? So what do you need to reinforce to make that work better? How do you know it's working better? So we can compare different models of care a little bit about that. And we've looked at caseload care, and not surprisingly, caseload care is very well evaluated. So in summary, the framework provides a comprehensive basis for discussing care quality. And if you want to think about that for your revalidation, think about if you're doing all those bits that are in that framework, and you can access the slides afterwards, it's free, available online anyway, to think about, am I doing all the things that's in there? Because if you are, then you're doing really, really well. So it's something to strive for, perhaps. But it does offer insight into different perspectives. And so we had service users, we had service providers, and we were allowed that you can compare across them, also between midwives and obstetricians, how different or similar are they. So if you ask the right questions and if you facilitate good discussions within a group, you can help to identify strengths and limitations of different areas of practice. And that helps to reinforce what's working well. It helps to identify where you've got issues or problems. So that's really, really useful. And you can compare different care models that way. As I say, reinforce, copy what works well. So what's next? Well, we've got a similar study that we're doing the analysis at the moment that's been running in New South Wales and Australia. As I say, they found slightly different things, but they've got a slightly different model, so it's not surprising. But we're working with the people there. I was there earlier this year, including with Caroline Homer, who's featured just in an earlier slide, I think, in Alison's talk. You talked about Caroline Homer. I saw Caroline when we were working in Sydney on this model. We've got people in the Netherlands who are doing the same thing. Now, we used to look at the Netherlands, Dutch midwifery, for great answers. They've had a bit of a rough time in the last few years. So they've not got the problems to seek, but they're using the same model, but they're doing the same kind of approach there. We've got an offer possibly to go to America and do some work with Holly Kennedy in Yale. My colleague Alison McFadden has just got back from Bangladesh, where they're using this as well. And we've had a possible invite to go and speak to people in Germany who are also using the framework to do that. So we can see that people around the world are actually taking this. This is a global quality care framework. So it should apply everywhere in the world. So if we're getting it right, if we're doing what's in the framework, we're doing really, really well. But it's a useful yardstick, I think, against which to measure what we're doing. So thank you very much. That's a canter through. Thank you very much.